In this presentation, I will talk about the periradicular diagnosis, or as we also call them, the periapical diagnosis. But the ADA call it as periradicular diagnosis, and that is more accurate than the periapical diagnosis, because when the disease occurs at that place, it may affect any area around the tooth, not only the periapical area. So that periradicular diagnosis is a more safe term than the periapical diagnosis, because periapical means only the area around the apex of the root. On the other hand, the periradicular means any area that surrounds any part of the root. So that I will talk about the periradicular diagnosis, which are a pulpal disease consequence. The periradicular diagnoses are: we have either a normal periradicular tissues, acute periodontitis, chronic periodontitis, acute abscess, chronic abscess, cellulitis, or condensing osteitis. And the first thing is the normal. As I always say, we should always know the normal so that then we can distinguish the abnormal. The normal periodontium anatomically looks like this. Okay, there are fibers that surround the tooth and attach it to the bone socket around it. Histologically, it appears like this. We have the pulp, the dentin, the cementum, and the periodontal ligaments that attaches them to the bone. And microscopically, they look like this. And clinically, we cannot see them by our eyes because they are embedded in the alveolar socket. But in general, the normal periodontium can be felt by the patient because they have nerve fibers. The normal periodontium has no pain on palpation and no pain on percussion. As we can see here in the left picture, this is a palpation for the periodontium when we insert our finger in the sulcus. And on the right pictures, we will see the horizontal percussion and vertical percussion. The vertical percussion is for the diagnosing of the periapical periodontitis or diseases or lesions. On the other hand, we have the horizontal percussion, which will aid us in the diagnosis of the other periodontium diseases. On the radiograph, also we cannot see the periodontium because they are a soft tissue, not a hard tissue. The PDLs are soft tissues, they are fibers, they are not hard tissue. But we can see the other parts of the periodontium because the periodontium is composed from the cementum, from the PDLs, and from the bone. And so that we can see only the cementum because it is a hard tissue, and bone because it is a hard tissue, and the periodontal ligaments are not seen here because they are soft tissues, and so that they are seen as a radiolucency and a black line. So that After knowing the normal of the periodontal ligaments and periodontium, let's now talk about the abnormal. The abnormal, as we have said previously, is the acute periodontitis, the chronic periodontitis, the acute abscess, the chronic abscess, cellulitis, and condensic osteitis. And all of these 6 conditions and diagnoses are for the periradicular tissues. Okay? Guys, when I am saying the diagnosis, I mean the diagnosis of the disease in that area, and it is an inflammatory lesion. And like any inflammation in our body, if you are burning your skin or your finger, you will feel pain if you hit that burned area. So that it is an inflammation, and so that we will hit it and see if it is painful or not. So that the vertical percussion to check the periapical periodontitis, while on the other hand the horizontal percussion is to check the other periodontal ligaments. So that the percussion is a very, very important diagnostic aid in the diagnosis of a periodontium diseases. Actually, it is not only an inflammation, it is actually a war that will destroy the bone and lead to bone resorption in that area. And because there will be a bone resorption, so that there will be a radiolucency. So that when we see a radiolucency in that area, that means that there is a disease process. And because it is embedded inside the bone, so that we are blind in the situation, we will not see that inflammation, but we will feel it by the palpation and percussion, and we will not see that radiolucency, but we will use our magical eyes and see that radiolucency. As you can see here in these 2 pictures, we can see that there is a radiolucency around the apex of these 2 teeth, the upper 5 on the right, and the lower central on the left. Okay, the final thing that we will use to diagnose a periodontal disease, which is the palpation of a swelling and the inspection of that swelling. We will see if there is a swelling or not, and that swelling is painful or not. So that it is very important to know these 3 things that we will use in our periradicular diagnosis, which are the pain by palpation and percussion, the radiolucency by the radiograph, and the presence of the swelling or not. Now let's talk about the first diagnosis, which is the acute periradicular periodontitis. The